With the growing spread of the highly transmissible Delta variant of the COVID-19 virus, COVID infection rates, hospitalizations, and deaths are once again rising in the United States in what the CDC calls a pandemic of the unvaccinated. That's why today's briefing focuses on the innovative approaches 3 community organizers have developed to reach unvaccinated Latinos in densely urban as well as suburban and rural parts of the state.
So I want to thank you. We've learned a few things in these months now of trying to get vaccines out. One is that the messenger is so important. And that's why we're grateful for all of you in the ethnic media who are here as trusted messengers of truth, pushing back on disinformation and connecting people with the news they need, in this case, to save lives. And we also know that we are learning what works from the people who are doing the work. And we are so, so blessed to have these 3 leaders from the 3 corners of California to share with us what is working, how we can support them in their critical work. And I'll just say, one of the things we know in working with older adults, that you always begin by asking older adults, what matters to you? What matters to you? Is it your family? Is it your health? Are you worried about your money, about your spirit? How can we meet you where you are? And so I'm so delighted to be here today and hear from the true experts.
What works is the personal talk. I think you knocking on somebody's door is going to bring out a different execution, or you're going to go. You don't know what route you're going to take with that person. But what does work is making that personal conversation, and the part of the education to that is not going to take a certain route right away, but a lot of the things that they can ask you, you're going to have to learn how to turn it around. You got to learn how to answer properly and how to kind of getting to their situation on a personal level and try to convince them in that sense to be able to turn it around and to be able to convince them to get the vaccination. That's I think that's what the door knocking and the personal conversation is what works the best. You have other programs out there, and phone banking is another one, but on the phone banking situation is a little bit harder because people just get annoying phone calls all the time, including, not to mention any names, but hotel brands and whatnot. And they're just used to just, not recognizing a phone number and hanging up immediately. But once you're there, they see you in your uniform. They see you got the get out the vaccine logo on there, and the organization you represent with ID badges. It's a little bit easier to talk to them and to try to make conversation and convince them to be able to get the vaccine.
You pay attention to what you can learn. Some of the challenges that we've had is the community is fearful of providing personal information due to immigration status. As I told you, a lot of folks are not documented. So anybody that is asking questions, especially you want to get the vaccine, initially you had to provide an ID. So nobody wants to provide their ID because they think the next thing's going to happen is INS or the immigration is going to be knocking on their doors to take them away. It's a working class neighborhood, and most people were not available for appointments Monday through Saturday. They were available for appointments on Sunday, but unfortunately, there were no places that were giving vaccinations on Sundays until recently with Supervisor Hilda Solis. Our next big issue is the very strong religious community that's present in the park. They're all against COVID-19. And so when we talk to folks for their parishioners or their followers, they say, their church leaders say, don't vaccinate, it would be a sin. They're actually injecting poison. There's a tremendous distrust of government and authority. So we originally were told to say, hello, my name is Irma Munoz, I'm with the Department of Public Health. We scratch that completely. We say, soy Irma Munoz, soy de Mujeres de la Tierra, and we mostly listen, but everybody who works on our team has received both vaccinations. And some of the folks that received both vaccinations resisted it. So they tell their personal stories of why they resisted and why they decided to get the vaccine. And so we've been quite successful in convincing people, but there are still in many places folks who don't want to get vaccinated for a number of reasons, religious, political, and being found out by the migra and putting them and their families in risk.
You know, vaccination, vaccinate yourself for the kids, like follow this message, you know, push that along throughout the state, because of the fact that the kids are going back to school now. And you have the people that are not vaccinated, and the correlation between those not vaccinated that are then infecting the children, and then the children go to school, and then there are other children who are of age that can't be vaccinated, and then those numbers are increasing. So then how is it that we're going to get the message across to all of those parents in the various languages? It has to continue to be the in-person communication. However, we do need to collaborate with all of our different agencies so that we're giving out the same message and we're getting people to get vaccinated, because that's going to be the only solution. And they're very hard to reach areas sometimes that we have also that are rural. So those communities that are in those rural areas sometimes do not have the same type of access to the internet and to social media. So I believe, I don't know what the study would be based on the percentage of outreach done on social media, but you still have to do the in-person. One of the challenges is because of the fact that the homes are so separate from one another, and because you have, you know, homes that are set back, you know, a ways from the road, you know, it's going to be difficult to reach them in person. That's one of the things that we've seen. We're very, very familiar with rural areas. EJCW has served and worked in primarily rural areas. So there has to be a combination thereof. However, the grant that we have doesn't really allow for a lot of monies in terms of publications, so that you can do the drops at the different locations when you go through the rural areas to get the word across, because you have to go back to that old-fashioned flyer type of drop to get to the rural areas.